Laryngitis. Anatomy and physiology of pharynx. The larynx is the voice box that allows us to speak, shout, whisper, and sing. The larynx consists of a cartilage skeleton that houses the vocal cords, which are covered by a mucus lining. Muscles inside the larynx adjust the position, shape, and tension of the vocal cords, allowing the voice to make different sounds like whispering, singing, and shouting. Any change in the airflow, which is generated by the lungs exhaling air across the vocal cords, will affect the voice and the quality of the sound. The larynx is located at the junction of the mouth and trachea, where air enters the lungs. There is a flap-like covering called the epiglottis, whose job it is to prevent food and saliva from entering the larynx during swallowing. Definition: laryngitis is an inflammation of the voice box and vocal cords, causing a person to lose their voice and become hoarse. The quality of the voice becomes gravelly sounding and sometimes too quiet or soft to hear. Laryngitis occurs when voice box or vocal cords become inflamed from overuse, irritation, or infection. Laryngitis can be acute, short-term, lasting less than 3 weeks. Or it can be chronic, long-term, lasting more than 3 weeks. Types: acute laryngitis. Most cases of laryngitis are temporary and improve after the underlying cause gets better. Causes of acute laryngitis include viral infections similar to those that cause a cold, vocal strain, caused by yelling or overusing voice, bacterial infections, such as diphtheria, although this is rare, in large part due to increasing rates of vaccination. Chronic laryngitis. Laryngitis that lasts longer than 3 weeks is known as chronic laryngitis. This type of laryngitis is generally caused by exposure to irritants over time. Chronic laryngitis can cause vocal cord strain and injuries or growths on the vocal cords, polyps or nodules. These injuries can be caused by inhaled irritants, such as chemical fumes, allergens or smoke. Acid reflux, also called gastroesophageal reflux disease, GERD. Chronic sinusitis. Excessive alcohol use. Habitual overuse of voice, such as with singers or cheerleaders. Smoking. Less common causes of chronic laryngitis include bacterial or fungal infections, infections with certain parasites. Other causes of chronic hoarseness include cancer, vocal cord paralysis, which can result from injury, a stroke, a lung tumor or other health conditions. Bowing of the vocal cords in old age. Risk factors. Risk factors for laryngitis include having a respiratory infection, such as a cold, bronchitis or sinusitis. Exposure to irritating substances, such as cigarette smoke, excessive alcohol intake, stomach acid or workplace chemicals. Overusing voice, by speaking too much, speaking too loudly, shouting or singing. Etiology. Though it's usually virus-related, there are also ongoing, or chronic, forms of the illness, generally brought on by smoking and alcohol abuse. Acid reflux can also play a role. Strine acids can travel up from the stomach into throat and get all the way to larynx. This can irritate it and make patient lose voice. Other causes of chronic cases include allergies, bacterial infection, fungal infection, such as thrush, injury, such as a hit to the throat, inhalation of chemical fumes, sinus disease. Some health conditions, including cancer, can also help cause laryngitis. Pathophysiology. Sign and symptoms. Laryngitis is often related to another illness, such as a cold, flu, or bronchitis. Symptoms include sore throat, a low-grade fever, hoarseness, trouble speaking, a dry cough, a constant urge to clear throat, swollen glands. Patient has a greater chance of getting it if patient smoke, overuse voice a lot, if patient are a singer or public speaker, for example, or are prone to colds, the flu, and bronchitis. Diagnostic evaluation. History taking. Complete history about present and past illness, chief complaints, family history, medication, surgery, personal history, habits, diet, allergy, psychosocial conditions, and socio-economic status. Physical exam. Examine the inside the mouth to look for signs of inflammation and infection of larynx. Assess mucous membranes, nasal discharge, nasal blockage, breathing problems, scratchy throat, pain on swallowing, voice changes, enlarged lymph nodes, etc. Throat culture. A throat culture remains the standard for diagnosis, though results can take as long as 48 hours. Throat culture results are highly sensitive and specific for group A beta hemolytic streptococci. Testing for viral causes. Obtain a complete blood count, CBC, to detect atypical cells in the white blood cell, WBC, differential. Radiography. Imaging studies are usually not necessary unless a retropharyngeal, parapharyngeal, or peritonsillar abscess is suspected. In such cases, a plain lateral neck film can be used as an initial screening tool. Endoscopy. Fiber optic scope, which is a lighted tube that passes through mouth. It's used for directly visualizing the inside of mouth. CT MRI scans. A CT MRI scan provides a 3D picture of sinuses. An MRI uses powerful magnets to create images of internal structures. Allergy test. An allergy test identifies irritants that may cause an allergic reaction. A blood test can check for diseases that weaken the immune system, such as HIV. Eye medical management. Simple home remedies include avoiding decongestants, as these dry out the throat. Breathing moist air. Using acetaminophen, such as paracetamol, or ibuprofen to control the pain. Avoiding inhalation of irritants, such as smoking or second-hand smoke. Drinking plenty of fluids. Antibiotics. If the tonsillitis is caused by group A streptococcus, then antibiotics are useful, with penicillin or amoxicillin being primary choices. Cephalosporins and macrolides are considered good alternatives to penicillin in the acute setting. A macrolide such as azithromycin or erythromycin is used for people allergic to penicillin. Individuals who fail penicillin therapy may respond to treatment effective against beta-lactamase-producing bacteria such as clindamycin or amoxicillin clavulanate. Pain medication. Paracetamol is recommended for the pain treatment. Although non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, and opioids such as codeine and tramadol are equally effective. Anesthetic mouthwash can also be used for symptomatic relief. Corticosteroids. Corticosteroids are helpful in the reduction of pain and improvement of symptoms in 24 to 48 hours. Oral corticosteroids are recommended unless the person is unable to swallow medications, e.g. dexamethasone, prednisolone, beclomethasone. Immune globulins. These agents are used to improve clinical aspects of the disease. It stimulates immune cells, reducing the severity of infection. 2. Nursing management. Nursing assessment. Assessment of patient with laryngitis include history of exposure. A history of exposure to known carriers, fever, headache, and abdominal pain in conjunction with a sore throat. History of intake. Because supportive care is a primary goal in all cases, historical information regarding oral intake and hydration status is important. Nursing diagnosis. Based on the assessment data, the major nursing diagnoses are ineffective breathing pattern related to the inflammatory process in the respiratory tract, ineffective airway clearance related to mechanical obstruction of the airway secretions and increased production of secretions, acute pain related to inflammation and edema of larynx, imbalanced nutrition less than body requirements related to pain on swallowing, anxiety related to the disease experienced by the patient, impaired verbal communication related to laryngeal inflammation. Nursing care planning and goals. The major nursing care planning goals for a patient with acute nasopharyngitis are: the patient will report increased energy. The patient will remain febrile. The patient will not experience intense pain. The patient will expectorate sputum effectively. The patient will express feelings of comfort in maintaining air exchange. The patient will experience no further signs or symptoms of infection. Nursing interventions. Nursing interventions for a patient with acute nasopharyngitis are: positioning. Place the patient in a semi-Fowler's position using pillows to facilitate lung expansion. Increase fluid intake. Encourage increased fluid intake to decrease the viscosity of secretions. Increase room humidity. Increase the humidity by using cool mist vaporizers to relieve stuffiness of the nose. Administer medications. Administer antibiotics as prescribed after a positive culture result. Provide diversional therapy to decrease perception on pain. Provide adequate nutrition. Facilitate communication by using nonverbal or written communication. Evaluation. Goals are met as evidenced by: the patient reported increased energy. The patient is febrile. The patient experienced less or no pain. The patient was able to expectorate sputum effectively. The patient expressed feelings of comfort in maintaining air exchange. The patient experienced no further signs or symptoms of infection. Patient will not be having communication problem. Complications. In some cases of laryngitis caused by infection, the infection may spread to other parts of the respiratory tract. Prevention. To prevent dryness or irritation to vocal cords, don't smoke, and avoid second-hand smoke. Smoke dries throat and irritates vocal cords. Limit alcohol and caffeine. These cause to lose total body water. Drink plenty of water. Fluids help keep the mucus in throat thin and easy to clear. Avoid eating spicy foods. Spicy foods can cause stomach acid to move into the throat or esophagus, causing heartburn or gastroesophageal reflux disease, GERD. Include whole grains, fruits and vegetables in patient diet. These foods contain vitamins A, E and C, and help keep the mucous membranes that line the throat healthy. Avoid clearing throat. This does more harm than good, because it causes an abnormal vibration of vocal cords and can increase swelling. Clearing throat also causes throat to secrete more mucus and feel more irritated, making patient want to clear throat again. Avoid upper respiratory infections. Wash hands often, and avoid contact with people who have upper respiratory infections such as colds.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.